Gentlemen, let me ask you something most people won't ask you directly. When was the last time you woke up with a strong, natural morning erection? Not from medication, not forced, not assisted, but simply your body responding the way it once did automatically? If you're struggling to remember, or if it's been weeks, months, or even years, I want you to understand something important right away. What you're experiencing is not a personal failure, and it is not something you should silently accept. In many cases, it's a signal, and when you learn how to read that signal correctly, it can change how you understand your body entirely. I'm Dr. Michelle Zion. I work in men's sexual health, hormonal balance, and neurological recovery, and for years I've sat across from men who believed their energy was gone for good, and that intimacy fading was simply what happens with age. But that assumption is often wrong. What I see again and again is not irreversible decline, it's depletion, and one of the most common and overlooked forms of depletion in men over 45 involves a single mineral that quietly affects sleep, blood flow, testosterone regulation, and nervous system recovery all at once. As men age, their ability to absorb and retain certain minerals gradually declines due to stress, poor sleep, medications, alcohol use, and modern diets. And when levels of this mineral drop, the first systems to suffer are often the most sensitive ones: sleep quality, energy regulation, and erectile function. The process usually unfolds quietly. You feel tired but wired, exhausted at night yet unable to fully shut down. Sleep becomes lighter and more fragmented. Blood vessels lose flexibility and circulation weakens. And because testosterone production depends heavily on deep, uninterrupted sleep, levels gradually fall, leading to weaker erections, lower libido, constant fatigue, and the subtle feeling that vitality is slipping away. Here is the critical truth. In many cases, this is not aging. It is mineral depletion, and depletion, when addressed correctly, can often be corrected. The mineral at the center of this process is magnesium, but most men take it incorrectly, in the wrong form, at the wrong time, or in a way their body cannot absorb. Magnesium exists in multiple forms, and only a few effectively support sleep regulation, vascular health, and nervous system recovery. Erectile function depends heavily on endothelial function, the ability of blood vessels to relax and expand efficiently, and magnesium supports this process by acting as a natural vasodilator, improving circulation and supporting firmer, more sustainable erections. Magnesium also helps shift the nervous system out of constant stress mode and into the parasympathetic repair state, which is essential because testosterone production peaks during deep sleep stages. Without deep sleep, hormonal repair never fully occurs, and magnesium helps guide the brain and body into those restorative sleep cycles where recovery and hormone regulation actually take place. One of the biggest mistakes men make is buying magnesium oxide, which is poorly absorbed and often causes digestive discomfort without delivering real benefits. The forms that matter most are magnesium glycinate, which supports muscle relaxation, blood vessel function, and deep sleep, and magnesium L-threonate, which is especially effective for calming the brain, reducing nighttime mental activity, and improving sleep quality. Timing also matters. Magnesium is a relaxant, not a stimulant, and taken early in the day it can cause sluggishness while missing the body's nighttime recovery window. The ideal time is approximately 30 to 60 minutes before bed, taken with warm water, sending a clear signal to your nervous system that it is time to shut down, restore, and rebuild. Magnesium is not a drug and does not override biology. Its benefits build gradually. Many men notice calmer evenings and faster sleep onset within the first few nights, deeper sleep and improved energy within 1 to 2 weeks, and as restorative sleep improves, morning erections often begin to return, and libido strengthens naturally. Magnesium works even better when combined with zinc and B-complex vitamins, which together support testosterone production, nervous system balance, and overnight recovery. This is not about quick fixes. It is about restoring what your body has slowly lost and allowing it to function the way it was always designed to. I have worked with men in their 50s, 60s, and even 70s who believed intimacy was no longer possible for them. Yet after correcting sleep quality and mineral deficiencies, many experienced morning erections for the first time in years, along with renewed confidence, energy, and presence in their relationships. This is not about chasing youth, it is about reclaiming vitality and dignity. Start tonight by choosing the correct form of magnesium, building a simple nighttime routine with dim lighting, reduced screen exposure, consistent sleep times, light stretching, and paying attention to how your body responds. Improve sleep, calmer nights, better mornings. These are signs your system is rebalancing. Weak erections, poor sleep, and low energy are not things you are required to accept. They are signals, and when you respond correctly, your body often responds remarkably well. If this helped you, support the channel so more men can hear this message, subscribe for practical science-based men's health education, leave your questions in the comments, and remember this: your vitality is not gone, it is waiting to be restored.